Okay, so remember the assessment for this goes something like this. We're going to train our patient to retract and then to come all the way forward. Ideally, this would be passive, but it's very hard to do completely passively, so it's good to have some patient cooperation. So when they come all the way forward, CO, C1, C2, especially CO, C1 is extending, T1, T2, T3 flexing, right? And when we come back, we're flexing at CO, C1, C2, CO, C1, C2, we're flexing, and T1, T2, T3 extending. That's about as far down as we go. So this adjustment would be to create flexion in the upper thoracic spine, T1, T2, T3. That's what you're trying to fix here. So the way we're going to set this up is to stabilize the patient by using your knee to kind of hold their arm in place. And just keep the arm in the plane of the scapula. And this will help stabilize the patient because they're seated. The doctor's going to be right behind the area that's being manipulated. In this case, it's T1, T2, T3. So we'll make a T1 contact. So I'm just taking my thumb and I'm placing it right on next to the T1 spinous. All right. So the patient's fully retracted and my contact's in place. All right. The back of the head is against my torso. All right. And I'm going to use my auxiliary hand to hold on to the head and control the movement. So from here, I load this up into some coupled lateral bending and a little bit of rotation away, all right? And then I instruct my patient to slowly goose that forward. So goose it, and I come with it as best as I can. Right? When it's come all the way forward, I impart that HVLA into the movement. All right? And that is an alternative to creating flexion in that T1, T2, T3 area. Probably best up at the T1, T2 level.